Good afternoon, everyone. Welcome to Gentle Movement at Home for the end of the week, Friday, June 19th. So I'm Jen Hansen. I work at Pain BC and joined today by Neil Pearson. Just a reminder that Neil is not able to provide medical advice, but we're happy to answer any questions you have about this session. You can enter your question into the Q&A and I will read it out for Neil at the end of this session. So please do. If you want to look at this recording again, or this session again, we are recording and the video is available on our YouTube channel and on our Facebook page. We have about 30 plus sessions there now, so a really good library of gentle movement and relaxation sessions. So we encourage you to share it with your family and friends and anyone you think might benefit. I'm going to launch a little poll at the end just so you can tell us what you thought of this session. If you need any help, do email us or put your question in the chat during the session. Next week, I believe, is our we're coming to a close of Gentle Movement at Home. So we're going to take a break from this for the summer and likely resume again in September. So this coming schedule is posted. We've got Monday, Thursday, and Friday, first two sessions with Neil, and last session with Colleen, and it'll be Colleen's third time teaching with us. So we will, anyway, so that's the session. I think that's all I have. Neil, over to you.
Great, thanks, Jen, and welcome everyone. So we're going to do a little bit more of an energetic practice this today. So it's still going to be gentle, and it's still going to have some of the relaxation aspect to it, but a little bit more about getting energy moving. So, this is the kind of practice that maybe if you're coming back and you're seeing this on YouTube, you'll use this one when you want to get a little bit more energy going. And it's one that will actually give a little bit more strength kind of thing, movements for your legs. So we're going to start in a seated position, and then we're going to move to standing. And we're going to use the chair because there's a few little things that will require some balance, but also some support as we go through this. So as with all of these sessions, if you're finding that there's a movement that doesn't feel like it's safe, you can feel free to modify it. You can please feel free to pause and stop. And we'll also talk a little bit about, if you're feeling in that place where you're not quite sure, one of the things that we would suggest you do is do your best to calm your breath, to calm your body tension, and to calm your mind. All certain, sort of skills we work at as we go through this. Because sometimes when we come up against something that is producing pain when we move, the practice or the skill that we gain by calming our breath, calming our body, calming our mind sometimes allows us to be able to move more in that moment with more ease, rather than just sort of gritting your teeth and carrying on. So let's start up. So hopefully you're seated in a comfortable place. You can feel your feet on the floor. You can feel a little length of your spine. Your shoulders are sinking down, so feel free to shift around a little bit. The weight's pretty even. You can feel your feet pretty evenly on the floor and pretty evenly on your seat. And just check in with what's happening around your face. So if your eyebrows are furrowed, see if you can soften that. If you're holding around your jaw, your tongue, your throat, or your neck, see if you can let some of that go. And if there's other areas of tension in your body, so those areas of your body that tend to get tense, see if you can find a little bit more relaxation there. Remember, you keep on practicing that. If you're relatively new to this idea of letting a muscle tension go, or even identifying muscle tension, you will get better as you practice this. And if you're struggling with that, certainly reach out to some of the healthcare professionals around who can give you some guidance. Just take a moment to check in. You've sort of checked in with body tension. And just check in, what's your breath feel like right now? Maybe it's smooth, maybe it feels sort of catchy. Maybe it feels short and you want to make it a bit longer. So if there's something about your breath that you want to go ahead and change, go ahead and change right now. All right, remember, we'll check in at the end again to see how you're doing. So right now, just for a moment, check in. Notice if you have pain. Notice the pain for a moment. Notice its size, its shape, where it is. And then see how best you can let that go and bring your attention back to your breath again. So this time I'm going to ask you to not just pay attention to your breath, but to change it. So as you breathe in, make your breath just a little bit bigger than it was a moment ago. So you're going to actually, this time, instead of making it longer like we often talk about here, make it actually a bit bigger. So bring in a bit more air than you were just a moment ago. So you're going to feel your ribs at the sides, and you're going to feel your chest and maybe in the back of your torso expanding a bit more. And maybe you can feel your belly expand a bit more as you breathe in. As you breathe out for right now, draw back in on purpose. I'm sure you've noticed that a lot of times your exhale just sort of happens passively. You don't have to actively work on getting the air to come back out again while you're sitting still. But for right now, make the inhale and the exhale active. So breathe in. If you can, expand around your ribs and around your belly and around your chest, like your whole torso is expanding out just a bit. And as you breathe out, just gently draw back in. So maybe your inhale and exhale are about 3 seconds each, or maybe they're even up around 5 or 6 seconds each. You have to play with it a bit to try to find the right amount of air to bring in so you don't feel like you're holding your breath or taking too long or running out of oxygen. It's like your torso is almost like a bit of a bellows, and as you breathe in, you're expanding the whole of the bellows, and sort of like top, bottom, all the sides of it. And as you breathe out, you're contracting gently, drawing the muscles around your ribs and around your belly and around your chest just back in again. Finding that right pace for you. And maybe you have a sensation that as you're breathing in, it's like you're drawing in all that energy. And as you breathe out, you're just gently pushing the air back out again. And as you do this, you can stay with this. Remember, stop anytime you want to or need to. Or maybe you can create that sensation almost like you're not just breathing into your lungs anymore. It's almost like the sensation of your breath is that expansion is almost like you're breathing into every part of your physical body a bit. Almost like the energy of the breath is reaching out through your shoulders and arms and out your hands. The energy of your breath is reaching out into your hips and knees, thighs, calves, ankles, feet, even up to the crown of your head. But you're not doing, it's not like a bellows that you're really, really cranking hard so you feel like too much energy is happening and too much fires are being built. There's just this sense of a little bit more energy as you do it. Now, if you still are going on with that breath, let it pause for a moment. Just let it go. If you're okay with closing your eyes, close your eyes, or just soften your gaze. Just notice how you're feeling to have breathed like that for a minute or two. Check in with how your breath feels. Check in with how your body feels, muscle tension, any pain. And if it feels like that breath served you, let's get you to come back to it again. If you feel like that really didn't work, if there's another breathing technique that you know is really, it's good breathing technique to use while you're moving, go ahead and do that. If that sort of complete breath that we just did isn't quite working, then make your breath longer and make your breath smoother, and focus on doing that as we go through this. So you've got those choices, either the one you know works, or this gentle, complete, or gentle bellows breath, or the longer, smoother. And so now I'm going to get you to come on up to standing. So you're going to need your chair. So probably best to put your chair this way, to the side. You can have it sitting in front of you while you're watching me. That's perfectly fine. I'm just going to put it to the side so you can see what I'm doing a little bit better. So actually what I'm going to do is turn the chair around the other way. it'll work better even this way. All right, so stand with your feet about shoulder distance apart or hip distance apart. Let your knees be a little bit soft, so don't have your knees in that all the way back position. Just release them a little bit. You can feel your feet on the floor. You can feel the length of your spine. Your shoulders are relaxed down. And just pause here for a moment and come back to your breath. Whatever breath pattern was serving you, just come back to that. I'm going to go back to that gentle bellows, expanding belly, ribs, chest, drawing back in as I breathe out gently. Great. So the first movement you're going to do, you may want to have your hands out on the chair if that's what will feel best for you, or you can just have the chair there for support. So let me back up just for a second. If your balance is a little bit off, you need more support, have the chair back around the other way so you can get your hands more easily on the back of the chair. If your balance is okay and your legs are feeling pretty strong, you can start from this position. So I'm going to be here, but you're going to have your hands on the back of that chair. So the first thing that you're going to do is you're going to come back to that breath, and then as you breathe out next time, let your knees bend just a little bit, and then come back up again. So this is where the chair can help you with balance and support. So you just, as you breathe out, you're coming down. As you breathe back in again, you're coming back up. So you don't have to go down very far, but if it feels okay to go down even further, you can go down further. Just get a little bit of energy happening in your legs, a little bit of work happening in your legs. And remember, you can pause anytime you want. You don't have to wait for me. If I'm still going and you're feeling that that's enough time to stop. So we're going to get you to add a different movement along with this. So you're going to come down, and then as you come up, you lift your arms. And then as you bend your knees, you let your arms come down and you come back up again. So if you try this and you feel like you need to have one hand on the chair, then go ahead, put one hand on the chair and lift the other arm up. And you could, if your balance is okay, you could go back and forth like this, right? Whichever pattern would work for you. If you're still going, just pause again. I'm going to turn to face you again for a moment, but you can stay facing your chair wherever you are. So stay in that standing position. You're just coming back to that breath, that gentle, complete breath of belly, ribs, chest, and then drawing back in, if that's what's serving you best right now. This time you're going to come up onto your toes. So you probably want to have your chair somewhere where you can put your hand on it for this time. So this is going to jump a bit right into a balance. So this time you're going to come up onto your toes like you're coming up like this. So you see from the side, I'm just coming up onto my toes this way and coming back down again, like that. And so the way I would like you to do this is to, as you breathe in, you come up on your toes. As you breathe out, come on back down. Just do your best to coordinate that breath. So as you're breathing in, you're expanding your belly, ribs, chest. As you breathe out, you're drawing back in and coming down. So coming up, expanding your breath, coming down, drawing back in. And so you're going to need to synchronize the length of the movement. So if your breath is more slow, then you're going to come up. It's going to take you more time, and you're going to come down more slowly. So play around with what feels like it's the best for this. Great. Now, if you feel like you can try it without your hand on the chair, you keep your hand close if you need to do that. Go ahead and try this way. Now, next time you go up, come on up and stay for a breath or two or three. So you're still breathing in, expand gently. Breathing out, drawing back in. Breathing in, expanding gently. Breathing out, drawing back in. Hand there if you need it. And as you breathe out next time, come on back down for a moment. Just shift your legs around a little bit because you may find that your calf muscles are feeling a little bit tense after doing that. Or maybe lift your foot up and circle your ankle around with one foot. Circle your foot around on the other side, whatever would feel like it's helpful. So I'm going to move this chair back here again to the side. And so face your chair. The first thing we're going to do is come down towards a forward bend. So your hands are going to come onto your thighs, and you're going to come down You can let your back bend forward just a little bit, and you can move with the hips to both of them together. If the chair is in front of you, what you might want to do is put your hands on the chair and come down this way. And then when you come up, come all the way back up again. Reach your hands out, come on down. If more support is the best thing to do, then it would be better to be in a place where you can keep your hands on the chair the whole time. So even as you come back up again, you still got your hands on the chair a little bit. Right, so you're going to come down to that just right distance when you do this. Now, if your back allows you to come down further, you can step back and use your hands on this part of the chair and come on back up again. And so you can play around with this and modify it and progress it depending on how you're feeling today or tomorrow or the next day. Maybe it's best to keep your hands up high or come down to this spot. And when you come back up again next time, just pause for a moment. Come back to that breath, that gentle expansion as you breathe in, gentle drawing in as you breathe out. Put your hands on the sides of your pelvis or on your hip. As you breathe in, come into a little bit of a back bend. And as you breathe out, come on back up again. So time the movement with your breath. And as you're doing this, you're expanding gently as you breathe in. And then you're drawing back in all the muscles as you breathe out. Doesn't matter how far you go whatever distance feels like the right amount to do. Great. If your legs need a bit of a shake around or shift around, go ahead and do that. So this time we're going to do somewhat of a similar movement to start with. We're going to come down into a bend where you either put your hands on the chair here or your hands on the chair here. So I'll start up here. So you're going to come to this position. You're going to bring yourself down and you're going to step your foot back, put your foot back up and stand back up again. So you bend forward, put your hands on the chair, reach to bend your front knee, take your other foot back and come on back up again. So you're doing your best to breathe while you do this. Doing your best to keep your body tension low, finding the right amount of coming forward. So hands go out, bend forward, bend your front knees, take that back foot back and come on back up. Remember, you can pause anytime you want to. You don't have to keep on going if it doesn't feel like the right thing to do for you today. You can pause and regroup and come back. Come on back up, check in, see how you're doing for a moment. Check in with your breath, your body, your mind. Notice what's happening with the pain. Because we're going to continue to do some similar movements like this. So if it's time to take a break, if it's time to have a seat for a few breaths, go ahead and do that. If you're okay with doing the next part. So the next part of this is you're going to take it a little bit further, this time take a knee down. So you're going to bend forward. And then you're going to take that back leg back and take the knee down to the floor. And then use your hands and your leg to bring yourself back up and come on back up to standing. So you reach out, take the chair, bend the front knee, put the back foot back, and then for the opposite foot back, bring the knee down to the floor, use the chair and your hands and your leg to come on back up. So once you have the movement, the idea is let's get the breath going with it. Now, the part that seems to work best for me is if I breathe out as I'm coming down and breathe in all the way back up again and breathe out as I'm coming down. Breathe in as I come back up again. But you're going to have to vary that with your breath. If your breath is a little bit faster than mine is, you'll either need to pick up the pace of the movement or slow down your breath, whichever would feel like the better way to go. So I'm just touching that back knee down. I'm not putting all my weight on it just yet. Great. And then come on back up again. Check in again. Put your feet about as wide as your hips. Put your hands on your hips again. Lift up your spine. Slow down your breath a little bit. Pull your shoulder blades back. Draw them down a little bit. Feel like your feet are pushing down into the floor. Come into a bit of a back bend again. With all these movements, you just go to that spot that feels like that's the right amount. So maybe for you for today, you can go way back and that feels like the right thing to do. Or maybe for today, a smaller movement feels like the right thing to do. Might feel better to pull your arms even back more. You need to decide for yourself. Go to that just right amount. Remember, you don't have to do as many reps as I do if you're feeling like it's time to stop. All right, for the next movement, you might need a blanket or a cushion. So I'm going to use this blanket that's here because I'm going to bring my knee down to the floor. So see, this probably would work best. I was a little bit more there. So I'm going to stand a little bit on the front of the blanket. I'm going to start with the movement like we did before. So I'm going to bend down, hold the chair, bend that front knee, put that back foot back, come down onto my knees so I'm here. And then once I get to here, either I'm going to have my hands on the chair, or I can just rest them here. And I'm going to move the chair forward just a little bit, that foot there. Is just come forward a little bit so I feel a stretch along the front of this hip and come back again. So if your hands are on the chair, you can keep your hands on the chair if that feels good, or up on the back of it, wherever your chair is. Just coming forward until you feel a gentle stretch here. And maybe you can lift your arms up as well as you do this. So you're coming forward, feeling that stretch, and then you're reaching up so you get a little bit more of a stretch in the front of your hip as you do this. So once you get the movement, see what you can do with your breath. So what's working best for me right now is as I breathe in, as I reach up, I'm breathing in. And as I bring my arms back down again, I'm breathing out and drawing my ribs back in. Expanding as I lift up, drawing back in as I bring my arms back down again. And I'm just going to slow it down a little bit because I feel better when my breath is a little slower than this. Great. So if you're still working on this, we're going to come back up to standing. So put your hands out on the chair or on the back of the chair. Take the weight onto that front leg. Come on back up. And again, if something needs to shift around, if you need to move your hips or your legs around a little bit, shoulders a bit, go ahead and do that. We'll try the same thing on the other side. So again, either stand on the edge of the blanket or just to the front of it. Bend forward, bend that knee, put the other knee down. So either have your hands still on the chair or here, and bring yourself forward and back. Just forward and back so you can feel what's happening in the front of that right hip when you're doing it here. So hopefully you've got cushion underneath that knee so it feels comfortable. And you're finding that just right stretch in the front of your hip. If this feels enough, stay with this. If you'd like some more, lift your arms up. When you do that, we usually feel more of a stretch on the front of the hip as you come forward. And so again, I'm going to slow down my breath. Remember, you can pause anytime you want. Working on gently expanding my belly and ribs and chest as I lift up. Gently drawing back in with my breath as my arms come back down again. It can take a lot more focus to work on the breath and the movement together. And do your best to Divide your attention. So even while you're doing this, you're not ignoring your body. You're not ignoring any pain you have. You're checking in, because maybe you're getting a message now that it's time to stop. If you stay too focused on your breath and too focused on the movement, you might miss the signals that are saying that's enough for right now. So if you're still going, come on back up to standing position. Once again, come to standing, check in, see how you're doing. Great. So I'm going to move this blanket out of the way again. Come back to this position. So you may still have that chair in front of you. I'm just facing you for right now. So you can have your hands on the back of the chair if that would feel the best. We're going to come back into a bit of a forward bend again. So place your hands on the front of your legs. As you breathe in, you're still expanding your rib cage and belly. As you breathe out, you're drawing back in again. Now the next time you breathe out, come forward into a forward bend. Let your hands roll down your legs. Bring your chin down a little bit and either round or bow yourself down to that just right spot and come on back up again. If you're doing this with the chair, your hands can come forward to here and you can come down and find that just right spot. Next time you come forward, come to a spot where you feel like I can stay there. And so maybe for you for today, it's a little bend like this, or maybe for you, you can go further. Maybe for you, you can put your hands way down here and come into even more of a bend forward like this. You have to decide for yourself which is the right spot. So you get to that place where you feel like I can stay here for a few breaths. So you're in a place where you can still get your rib cage to expand gently as you breathe in, draw back in as you breathe out. Remember, anytime you feel like it's time to stop, you do not need to wait. Listen to your breath, listen to your body, listen to your mind. Pay some attention to the pain too. Don't ignore it. Now, if you're still here, push down on the chair, maybe bend your knees, come on back up, because it usually feels way better to come up if you bend your knees while you do that. And then just check in again, see how you're doing. If it would feel okay to do it, put your hands back on your hips again. Come into a gentle back bend. Sometimes it feels better. You can play with it. Sometimes it feels better to go the opposite way. When you've been in one direction, going the other way feels good for a while. Now, either keep on doing this movement, or if it would feel okay, next time you go back, find a place here where you can stay, where you can still feel the expansion of your belly and ribs and chest. It'll be different because of this position. You can still feel that drawing back in as you breathe out. And maybe you've noticed my head's not looking way back because I feel like I'm way better if I look forward when I do this. I don't feel like I'm going to topple backwards. If I need my hand on the chair, I would have my hand on the chair. I'm staying at just right amount, not ignoring the messages. If you're still here, come on back up again. Have a seat back in your chair. So you may need to come around to the front of it, but have a seat back in your chair again. Once you come back to the chair, let your spine round this direction and then come this direction again. Just move your spine back and forth. After being in that standing position for a while, you may feel that the muscles are starting to get tense. And so sort of be curious. Notice what happens when you move your spine around. That starts to let the muscles let go a bit. And it may depend on how much you move. If you do it too big, you may find that that's more than feels good. And so you might want to do a smaller movement. Great. So you can feel your pelvis rocking back and forth here. You can feel your low back, mid back, and upper back coming towards that round position and coming back again. Come back to a neutral spot and then come back to your breath. Gently expand belly, ribs, chest as you breathe in. Gently draw back in as you breathe out. Divide your attention so you can feel your breath. You can feel your feet on the floor. You can feel your seat on the chair. As you breathe out next time, bring yourself around into a twist towards the left. So you can take your right hand on your right knee, left hand on the side of your leg or the chair, and then come on back to the front. As you breathe in, as you breathe out, come the other way. So again, sync up the movement with your breath. So as long as it takes you to breathe out, come into a gentle twist to the one side. As long as it takes you to breathe in, come back to the center. And then same thing. Breathe out as you go to the other side. So find that just right amount of movement, but sync up the movement with your breath. And with this breath pattern, if you're okay with it, of a gently expanding belly, ribs, chest as you breathe in and come back to the center, and gently drawing in your belly and ribs and chest as you breathe out and go to the side. Come back to the center next time. Just pause for a moment. Shift around if that would feel good. Put your hands together in front of you. As you breathe in, reach out forward, bring your chin down and reach with your shoulder blades. As you breathe back out again, release and you let your hands back down. So breathe in, expand, and reach. Breathe out, draw back in, and let your arms come on back in as well, and your shoulders come back down, and your spine reach up. Just do that one more time if that feels okay. Pause if it's time to pause. Give your arms a bit of a shake if that feels good. We're going to come into a side bend from here. So we'll start with our neck, spine up tall. So try not to start from here. Try to be more in this kind of a position. Let your left ear come down towards your shoulder. Let your spine come down to the side. If it would feel good to hold onto the chair so you don't feel like you're going to tip over, do that. And then come on back up. And try the other side. Head down towards the right. Let your spine come down. Now, it usually feels best to breathe out while you come down and to breathe in and expand as you come back up again. As you breathe out, draw in and reach down. Breathe in, come on back up. But sync it up whatever way feels best for you. Sometimes we've learned how to breathe with movements the same way all the time. Sometimes then someone comes along and suggests that we breathe in a different way. And it can be of interest, intriguing, curious to see what will happen if you go the opposite way. Now, next time you come back up again, you have a choice when you go down. You either go down as you have or take that arm and reach it over towards the side of the room or straight up to the sky. As you come back up, let your arm come down. Go to the side, take your arm either straight to the sky or across your ear like you're reaching it to the side. Now, as you're doing this, try to be careful that you don't fall down into this position. It's not that there's any harm that's going to happen when you're at position. To get more of a side bend, to allow your spine to move with more ease, you'll do that better if you're up straight. And so as you come down this side, you're keeping your spine sort of tall this way, even as you're bending it to the side. And maybe you reach that arm to the side, reach it up and across if that would feel good. And then one more time, this is last side. And let your arm come on back down again. Give yourself a bit of a wiggle around. Check in again. Maybe it's time to sit at the back of the chair and give yourself a bit of a break, your body a little bit more of a break, or maybe you're okay sitting here on the edge of the chair, lengthening your spine, closing your eyes or softening your gaze, and just noticing what's happening. It's always good to check in and see how you're doing today. So maybe today's a day to challenge yourself more, or maybe today's a day where a little bit more taking a break and a little bit more calming things down would be more important than trying to challenge things. So if you're doing all right, you can have your back against the back of the chair right now. You can be sitting out here. Take your right arm out in front of you and just take your hand and pull it across the front of your body and bring it back down. And we'll do the same thing on the other side. Other arm comes out and then just pull it across the front of your body. So you're feeling a stretch through your shoulder. Keep your torso about still as you do it. And while you're doing this, you can let go of that breath pattern if you want to. It might feel better just to let your breath do what it's doing. Sort of let it happen on its own. And let your arm come on back down again. So if you're okay with sitting at the side of the chair or the edge of the chair, sit to the edge of the chair, get your spine a little bit tall again. Come back to that breath. Expand your ribs and your belly and your chest as you breathe in. 3, 4, 5, even 6 seconds if that feels all right. And as you breathe out, gently draw back in. You don't need to push it all out at once, just slowly draw in. And when you breathe out next time, your hands are on your knees. As you breathe out, yourself bow forward. And then when you breathe back in again, come on back up again. So as you breathe out, come forward, like you're hinging at your hips and your waist. Breathe in, come on back up. So see if you can sync up your breath. So if you sort of lost it, come back to your hands are here, your spine is tall. Breathe in gently, that gentle bellows, belly, ribs, chest as you breathe in. And as you breathe out, when you start to breathe out, draw in and come forward. 3 or 4 or 5 or 6 seconds, whatever feels right for you. Then breathe in, come on up slowly. Use your hands as much as you want to, and use the muscles of your back. So once you get the breath synced up and the movement smoother, maybe that'll change how far you can go or how far you want to go. You're doing your best to divide your attention and your effort between your breath and this gentle coming forward and coming back up again, using your arms as much as you want to or need to, using the muscles around your back to help you release down, to help you draw up, but also using your arms. Let's try it one more time. If you're still doing okay, if it's time to pause, go ahead and pause. Just come back up again. Let your arms relax just for a moment. I'm going to sit to the side this time. You can stay exactly where you are. I just want to show you this. So you take your hands behind you, either put your hands together like this, or you can grab onto the back of the chair, whatever would work for you. I can reach my hands down in this hole at the back of the chair, which works really well. You may find that you need to sit further towards the edge of the chair to be able to get your arms back there. So your hands are just together at the back. You're going to pull your shoulder blades back this way, pull your shoulder blades down, and lift your chest up a little bit, lift your chin up a little bit, and just pause there for a few breaths. So you're in this position, shoulder blades pulling back and gently down. And rather than the sort of in and out movements and the repeated movements we've been doing, find a place where you can stay, where you can feel your chest and your ribs and your belly gently expanding while you breathe in. And while you hold this position, you draw back in. You feel the muscles around your ribs and your chest and your belly drawing in as you breathe out. Knowing you can stop anytime you want to. You don't have to keep going. If you're running out of breath or your body's saying that's enough for right now, pause. Move around a bit. If you're okay with staying, stay. And as you let your exhale go the next time, let your arms go. Shake them around a little bit. Shake your body around a little bit. Remember that one of the most important things around this gentle movement and this approach that we're showing here, demonstrating, and that you're experiencing here, is that success is trying to figure out, or success is finding out how much you can do, of that, finding that spot where if you stop, you say, yes, I gave myself the right amount of challenge now, and I stopped at the spot, and I'm feeling myself recover. Whether you're recovering, your muscles are calming down again, or you're catching your breath again quickly, or the pain is calming down quickly, that you feel that relatively quick resolution of whatever message was saying to you, maybe it's time to stop now. That's success. That's more success in doing that than just sticking with it as long as you can. So if you aren't against the back of the chair, bring yourself back against the back of your chair. Let your shoulders relax again. Let's just do a quick scan through our bodies. So notice what's happening down your feet right now. Maybe you can feel your feet resting on the floor, the big toe mound, the little toe mound, the heels. Maybe you can feel the arches of your feet and the all through the soles of your feet and the top, your ankles. Just notice whatever sensations are down there. Just taking a few moments here to check in and notice the subtle sensations of your physical body. Doing your best to keep your mind focused on this. Notice your ankles, notice your shins, notice the calves. Each time you notice a new sensation, just check it out for a moment and then let it go and look around. Be an explorer. Look for the subtle sensations of your physical body. And do the same thing around your knees and your thighs. Check in, notice the sensations there. Make sure you notice the right and the left, the front and the back, insides and outsides. When you notice a sensation, check it out, let it go, and move on and look for other sensations. Shift up around your hips and your pelvis and notice the sensations that are there. On the right and on the left, all through the back and all through the front. And notice what's happening around the outside and on the inside of your hips and pelvis. Then take your attention to your lower torso. Notice your belly. These are the sides of your belly between your ribs and your pelvis. Notice across your lower back. Notice whatever's there. If you do run into any pain or discomfort or tension, same idea. Notice it. Check it out just for a moment and then see if you can let it go. And look around and see what other sensations are there. Then move up your torso. Notice the sensations around your ribs, the sides, the front, and the back. Notice the sensations around your chest, around your shoulder blades, around your upper back. Notice your shoulders, right and left. Scan through the tops of them, the outsides of them, the undersides of them, the backs. Notice the sensations of your arms, elbows, forearms, wrists, hands, fingers, thumbs. Not spending too much time on any one spot. Then shift your attention up to your neck and notice the front of your neck and the back of your neck and the right side and the left side. Notice sensations of your skin and of your muscles inside and outside. And then take all of your attention up to your head and notice the sensations of your head. Notice around the back of your head and the top, on the sides of your head, to your temples. Notice those sensations around your forehead. And then notice whatever sensations you can feel in your face, around your eyes and ears, cheeks, jaw, lips, nose. And then for a moment, bring all of your attention back to your breath. So if you happen to still be breathing with that gentle bellows or that gentle complete breath, let that go for now. And just notice what's happening in your breath right now. Check in and notice what's happening with any pain, tension, or discomfort. Notice what's happening in your thoughts. Notice if there's any emotions there right now. Sometimes moving around can give us a sense of more freedom, more joy, more peace. Sometimes when our energy is low, it can give us that sense of, oh, I'm not sure if that was the right thing to do. Sometimes it can make us a little bit worried or anxious. Just notice whatever's there. It can help sometimes to notice rather than to get wrapped up in it. And then check in for a moment and notice what's happening in around your heart. And then you can let all that go. And if there's something that you want to remember from this practice today, something that you noticed, or something that you, a new approach to movement, or maybe something about that breath that you want to write down, maybe write it down or just park that idea just for a few moments. Jen's going to come on and put on a poll. You can let us know what you thought of this. And also, if you have any questions, let us know about that.
All right, thank you, Neil. Thanks, everyone. I've launched the poll. So go ahead and throw your answers in there. And if you have a question for Neil, you can see at the bottom of your controls, there's a little button that says Q&A. If you click on that, it'll open a window and you can type your question in there for Neil. So we'll just give it a couple minutes. Everyone's still doing the poll. Yeah, we'll just give it a second. Great.
So Jen, while people are doing that, I noticed there was a media report this morning on a study where they used an app to see if people logged their pain, that the app was actually logging what was happening in the weather. And it was in the UK, over 10,000 people they started with, but from the use of the app, they brought down like 2,600 people, I think was where they got to. But they could see a very close relationship between chronic pain symptoms and the weather. Actually, even the wind and pressure, and I think humidity as well, which is really fascinating because there's been a lot of research that's trying to look at this and has never been able to see a close connection between the two.
Really?
Yeah, which I think was really funny because, well, not funny in a sort of bad way, is that anybody who's got chronic pain will pretty much tell you that there's a connection. Yet a lot of people were being told, no, there's not really a connection. It's just all in your head.
Right.
Of course, what this research is showing is that no, there are changes here that are consistent across a lot of people.
Right. And so, Neil, did it show, like, I'm sort of assuming, like, on windy days, was it consistently, like, people's pain was worse? And on rainy days, it was worse? Like, did it correlate with bad weather?
Yeah, so that's what they were looking at, was they needed to find with each person that they had completed the app on some days when there was that kind of weather, but then they also needed to complete the app on a number of days when the weather was more stable,
Right.
so that they could see that association. So I haven't read the whole report yet, but I thought it was, it's it's validating, because so many times we've heard the story that, yeah, no, the weather has nothing to do with your pain, even though people in pain will say, well, yes, it does.
Well, yeah, no surprise to everyone, or no surprise to us, I guess, is like we need to listen to people in pain.
Well, yeah, and I think to me it's one of those important things, as you know, as a academic, my job as professor, to look at the research, but the research has said there wasn't a clear pattern, but that sometimes means that we don't have a good measurement tool.
Right.
And I think that's what was going on here. We didn't have a good enough measurement tool to pay attention to enough people, and this online app was allowed to do that.
So cool. Thanks for sharing that.
Okay.
All right. Okay, thank you everyone who voted in the poll. I think we'll end it now. No questions, Neil. So have a great weekend. Have a great weekend, everyone who joined us today, and thanks for coming, and I hope to see you next week.
All right. Bye for now.
Bye.